You mentioned that in the same chapter that many non-medical people with a passion for vegan nutrition know far more about authentic nutrition than most doctors. Boy, the average reader, listener, I really like for them to kind of get their hands around this.
Yeah, I mean, it's pretty frightening, you know, and I'm not against doctors. Let's start with that one. I mean, these colleagues of mine, you know, these poor people are victims in most cases. And listen closely before you close your mind to this. Imagine being an 18-year-old girl or boy and saying, you know, to yourself, what do I want to do for the rest of my life? Do I want to make a lot of money? Well, your first choice wouldn't be to say at 18, I want to go to school until I'm in my 30s. I want to go an extra 12 years to school to become a doctor. Because people with that level of intellect and education potential could look up on the Internet and find that doctors do not make a lot of money in most cases. So these young 18 and 19-year-old kids go into medicine because they have their heart in the right spot. And they literally want to do good, and they want to help people. And they go in there and they get educated through the eyes of and control of the pharmaceutical industry. And then they get out, other than the very astute, specialized medical doctors, and all they really are is glorified pharmacists. And although they're highly educated on anatomy, biochemistry, physiology, organic chemistry, by the way, they're pretty dysfunctional when it comes to health. And it's ironic we call it the health care system because it's a crises and disease management system. What does it have to do with health? And these poor doctors who go through this pharmaceutical education, we call allopathic training, literally have little to no nutritional education. And the average college today that thinks it's really hot on this is giving 12 hours, maybe 20 hours of, quote, nutritional education, all of which is wrong, by the way. It goes back to the flawed foundation and the old paradigm that says chemical supplements are great. Now, most doctors that I know that are not educated in the way that many of the listeners are today and we are here at Hippocrates would literally look at Reader's Digest or an advertisement in an article in Time magazine or the scientific journals that all of us read and read a short, you know, 2-paragraph article on a new supplement and walk back in with that information and tell their patients about it. And so I see the waves and the trends, just like even the natural, quote, alternative doctors all got caught up in this fish oil scam. I mean, it's just like big waves, and nobody has the time, and nobody takes the time, and nobody fully do their due diligence on it, so we end up being conned. Even those of us that are in the profession that aren't thinking people, who are not working as we do here at Hippocrates on the front line of serious disease. After medicine fails, many of these people show up here. Two kinds of people come to Hippocrates. Very smart people that want to be at maximum health and doing the best they possibly can so they don't age and they don't get sick, and people who are very, very sick. And we watch what happens once we start to employ common sense methodologies of natural organic biology. And, you know, this is not something that we guess here. I mean, we've had 250,000 people that we've done this on in clinical research on humans. And so we see the results of these things. But sadly, when you look at the poor doctor, they don't know a thing. And by the way, when you have a private practice, which I attempted to do in New York, and I felt like a fraud after a year, so I quit doing it, you don't get people to do very much. You know, you give them a prescription in the case of a doctor. In my case, I gave them a lifestyle, and I came back and saw them, or they came to see me in a month or two, and 9 out of 10 of them didn't do a thing I asked them to do. Well, the same thing happens with the doctor. He or she is seeing 50 patients, 80 patients a day. They're running in and out. The nurses are running the practices. The doctor has no time to say anything, have any conversation with you, learn anything about it. Have you been to another doctor? Are you taking anything else? Are you taking a supplement? The most they can say is what they read in Reader's Digest yesterday. Bang, bang, bang. Sounds like the hip doctor who read Reader's Digest. And this is why it is a misnomer and a gross, gross problem to think that doctors are the place to go to learn about health. Allopathic doctors do not know about health. Now, there are exceptions, obviously. Those women and men that were courageous enough to go through the 12 years and realize, yes, there's a place for modern medicine. I'm a big believer in that. There's a place for the diagnostic work, but that's not the end all and where we have to bring the people. We have to tell people about lifestyle to prevent disease. We have to tell people about lifestyle and dietary, nutritional. But how does a doctor do that unless after the 12 years of education, they either have a personal experience or one of their family members or somebody they know close heal themselves in the way that Hippocrates has been helping, and then they have personal interest enough to go on and be educated. Now, these people are exhausting schedules, and so I take my hat off for those doctors that do that and make the next step. But I must say to you that I believe that 8 out of 10 of those doctors are not really practicing natural medicine, that they've just gone from giving lots of pharmaceutical drugs that we pretty much know can be dangerous for you to giving dangerous chemical supplements. And that's what we call, the natural doctor today. There's maybe 20% that take it to the next place where it should go and talk really about lifestyle and whole food supplementation and psychology and the importance of that and exercise and all the things that really make a person well. But those doctors, sadly, are almost exclusively working with people with money. They're not going to people who cannot afford boutique medicine, as we call it, and where a doctor can look you in the eye and spend 30, 40, 50 minutes with you. Get to know you, get to know your history. Boutique medicine is where the elite and people with economic ability and strength go. And in even the countries that have pretty successful socialized medical systems, the people with money do not go through that system. They go to the boutique doctors today.